On this Monday night, a COVID-19 vaccine coming sooner than expected to Canada. When will it arrive and how many doses?
Thank God.
Plus, the complexities of distributing a vaccine that must be kept ultra cold and what it means about who would get it first. Anxiety in Alberta.
If we really try to process everything we're going through, I think we would break.
What one mayor says he's prepared to do as pressure mounts on the premier to impose restrictions. A COVID-19 outbreak at a BC mink farm. The fears this could spawn another public health threat. And another mystery spike.
It was crazy. I was like, oh my God, we've got one here.
What's up with all these monoliths?
Global National with Donna Friesen.
Good evening and thanks for joining us. Canada is on the cusp of taking delivery of the first vaccine for COVID-19, and it's happening earlier than originally expected. The federal government now says the first doses of the Pfizer-BioNTech vaccine could arrive as early as next week. Health Canada hasn't approved it yet. It is still reviewing data from several vaccine candidates, but it could approve the Pfizer-BioNTech vaccine later this week. And the Prime Minister said today a deal has been made to get up to 249,000 doses of it delivered shortly after that.
We are facing the largest immunization in the history of our country. This is no small task, which is why we have a clear plan. Pending Health Canada approval, the first shipment of doses is tracking for delivery next week.
That plan depends on preparing 14 vaccination sites equipped with ultra-cold freezers essential to store the Pfizer vaccine. The plan is for every province to have at least one site. The four biggest provinces, Quebec, Ontario, Alberta, and BC, will have 2. Doses will be doled out to the regions on a per capita basis, though because of the logistical challenges of the ultra-cold storage, the territories won't be part of this initial round of the Pfizer vaccine. The cold chain distribution will play a big role in who gets the Pfizer vaccine first. It's complicated to store and requires 2 doses, and not everyone will get it. The initial 249,000 doses will be enough to vaccinate about 125,000 Canadians. Contracts have been signed for more doses in the months ahead, not just from Pfizer, but from other manufacturers. And tonight, Canada is closer than ever to getting this mass immunization program underway. Mercedes Stevenson has our top story tonight.
Today is a great day for Canada and for Canadians.
After weeks of mounting pressure on the federal government about when Canadians would see a COVID-19 vaccine, some unexpected good news.
We can assure Canadians that we will have early doses of the Pfizer vaccine in this country. The light at the end of the tunnel is clear.
The relief in the provinces, clear.
Newfoundland and Labrador is one of the 14 vaccine distribution sites Prime Minister Trudeau just announced. Thank God.
Pfizer will deliver the vaccine to ultra-cold freezers at hospitals and universities across Canada, but it is up to provinces to determine who rolls up their sleeves first.
We just need to, set up the expectations that this is going to be a very limited supply, especially early on, and so it'll be very minimal scope on who we can immunize with it.
At the front of the line in most provinces, the elderly, those working in long-term care homes, and healthcare providers, as well as Indigenous Canadians. But there could be a hiccup. The Pfizer vaccine is temperature sensitive, and it's not clear whether it must be injected at the same site Pfizer is delivering to, or if it could be transported to long-term care homes and other locations.
We're still in discussions with Pfizer to understand whether the doses must be left at that initial place and then people come to where the vaccines are located, or if there is some ability to move the vaccine slightly.
For the vulnerable elderly, that might mean waiting for the Moderna vaccine, which the company says could be ready for delivery this month too. It also means the territories and Indigenous Canadians in remote communities will have to wait.
Might be a focus on urban centers or places where it's more, amenable to having those vaccinations take place. And then as we get more and more doses, we'll be able to offer it to more and more Canadians.
Prime Minister Trudeau says the first run will give the country a vital roadmap. Donna, Pfizer and Health Canada are conducting a dry run today that includes dry ice to mimic the procedure and try to sort out any hitches in the plan before the real vaccines roll out.
All right, Mercedes Stevenson in Ottawa, thanks. Administering the vaccine, as Mercedes reported, when it's approved and deciding who gets it first is up to the provinces. It is clear the priority will be frontline healthcare workers and the most vulnerable. Quebec, which recorded more than 1,500 new cases for the third straight day and has more than 800 COVID patients in the hospital, is one of the hardest hit regions, and it unveiled its vaccination plan today. Mike Armstrong reports.
The plan is to hit the ground running. Quebec's health minister says next Monday, December 14th, the province will take possession of 4 boxes of Pfizer vaccine, about 4,000 doses. They'll be delivered to 2 sites, one in Montreal and one in Quebec City. And as quickly as possible, the plan is to use those doses to vaccinate seniors in 2 long-term care facilities.
That's really our first test. That's important.
The health minister has been in contact with Pfizer and hopes to have a bigger shipment later this month, 57 more boxes. The province has set criteria of who it wants to vaccinate first, and age is the biggest priority. That means long-term care facilities go first, but as that happens, they're also going to be hitting at least some of the second group, healthcare workers.
We need to make sure we protect the patient, but we need also to make sure that we protect the people that work for them.
Once those 2 first groups are done, Quebec's plan would be to hit isolated communities and then groups based on age, working down, 80 and over, 70 over, and so on. It will be a massive effort, but one the province is confident it can pull off. Quebec's already vaccinating about 250,000 people a week for influenza. It'll be months before there's enough COVID-19 vaccine to get to that rate. Now, Quebec hospitals are starting to be overwhelmed. The Lakeshore General on Montreal's West Island is over capacity and has shut down its emergency ward. The health minister says the province has been operating the healthcare system at about 80% and is cutting that to 50%. That means turning away patients who need treatments and operations. The restrictions in place, including banning Christmas gatherings, are needed.
We don't want to lose the focus despite this good news that we have.
The effect of the vaccine, or getting back to life as normal, is still a long way down the road. But it also appears this good news is arriving as we enter what may be the toughest stretch of the pandemic. Mike Armstrong, Global News, Montreal.
It's been 2 weeks since tighter restrictions were introduced in the hardest hit areas of Ontario, and the virus is still spreading. Ontario had a record number of new cases reported today, more than 1,900. Most of the infections are in the Toronto and Peel regions, which moved into lockdown on November 23rd. And in Alberta, the last round of restrictions, the most moderate in the country, were implemented 10 days ago. There is nothing to suggest they are working. In the past 24 hours, more than 1,700 Albertans tested positive and 16 more people have died. On social media today, Alberta's premier reaffirmed his commitment to defend freedom. And the mayor of Calgary promised he will take action if the province does not. As politicians talk, hospitals are dealing with the grim reality. Heather Urix-West reports.
A doctor inside this Edmonton long-term care center calls the situation inside apocalyptic. Sunday, 8 more deaths were tallied associated with an outbreak that has so far killed at least 15.
We're crying a lot on the phone with each other and in person as well, and feeling pretty tired and helpless.
At Edmonton's Royal Alexandra Hospital, long days inside busy COVID wards are also taking a toll.
I'm living 24 hours at a time. And I think most of my colleagues are the same way. If we really try to process everything we're going through, I think we would break.
Dr. Nija Baxi says Alberta is now facing the kind of situation New York and Italy faced in the spring.
And the fact that we've had no significant restrictions placed on us as a community or society, it makes it even more dire to think like there's no ending.
Alberta's last round of restrictions was announced on November 24th and took full effect on November 27th. Since then, the number of new infections has risen from 1,261 to 1,836 Sunday, while the number of people in hospital has more than doubled.
I will be blunt. So far, we are not bending the curve back down.
Alberta's chief medical health officer says her team is working on new recommendations to present to the province. On the West Block Sunday, Alberta's health minister said new restrictions could be coming, but perhaps not right away.
We did tell Albertans that if we did not see reductions in cases as a result of those new measures that were imposed, that we would, before in December 15th, be reviewing that data with our public health officials and be determining whether further measures would be required.
But on social media, Monday, Alberta's premier again pushed back against calls for a lockdown, sharing on Facebook that constitutionally protected freedoms of Albertans must be respected and defended, and any abridgment of those rights must be done as a last resort, not a first resort. Calgary's mayor says the province needs to act now, adding that if it does not, the city is prepared to take action.
My number one duty as the mayor is to protect the health of the citizens of Calgary who put their trust in me. And whether or not I have the black line jurisdictional authority to do that, the city will have to act without the province, but I hope it doesn't come to that.
Leaving Albertans waiting as COVID cases continue to rise. Heather Urix-West, Global News, Calgary.
Canada's smallest province has imposed a 2-week circuit breaker lockdown to contain an emerging outbreak of COVID-19 there. 4 new cases were reported on PEI today, all of them in people under the age of 40. They're all a result of close contact with 3 fast food restaurant workers who tested positive over the weekend.
The circuit breaker is necessary for us to help stop the spread of COVID in our province. Certainly wasn't a decision that we wanted to make, but it was a decision that we needed to make.
Restaurant dining rooms, gyms and libraries are among the facilities on PEI that will be shut down until at least December 21st. Retail stores can operate at half capacity and gatherings are limited to 10 people. Hospitals and long-term care homes will limit access to 1 designated visitor per resident. In the U.S., restrictions are now being tightened in several regions as the number of COVID cases there keeps rising rapidly. In the first 5 days of December, another 1 million infections were added to the nation's staggering tally. The U.S. is now on track to surpass 15 million cases by tomorrow. This is likely a surge of positive tests after Thanksgiving, and there are more holidays in the weeks ahead. Health workers could be facing a tsunami of new cases before the first rounds of vaccinations have even begun. Jackson Prosco reports.
In Reno, Nevada, overwhelmed hospitals have had to start providing treatment outdoors in the parking garage.
Never in my wildest nightmares would I ever have thought that we would ever see something that would be killing this many people.
Near Boston, a field hospital that originally closed in May is preparing to accept a second round of COVID-19 patients.
It requires everyone to do the right thing every day if you're going to stop the spread.
Spread that's now so rapid, states are scrambling to bring it under control. California logged more than 30,000 cases on Sunday. The day before, it put 85% of residents under strict new stay-at-home orders that shutter restaurants for a second time.
We're a little nervous that we're not going to make it, honestly.
There's near universal fear about a lack of hospital capacity.
These patients are not going to stop coming in these next few weeks, especially after we feel the effects of Thanksgiving.
The worry is that surge will arrive just as people gather again for the holidays.
Without substantial mitigation, the middle of January can be a really dark time for us.
Yet there's near silence from the White House. On Monday, President Donald Trump spoke only of the positive diagnosis and hospitalization of his personal lawyer, Rudy Giuliani.
Rudy's doing well. I just spoke to him. He's doing very well.
In recent days, Giuliani has been traveling the country, mostly maskless, as part of the president's efforts to overturn the election. His contact with Arizona lawmakers has forced that state's legislature into recess. The virus is now so pervasive that it will dominate Trump's final 44 days in office by exacting an unimaginable toll on the American people. Jackson Prosco, Global News, Washington.
COVID-19 at a Canadian mink farm. Coming up, is a cull coming? What scientists are watching for. After that huge cull of millions of mink on farms in Denmark, there were fears COVID-19 might appear in mink farms around the world. Well, now it's beginning to happen. An outbreak among workers has been declared on a mink farm in British Columbia's Fraser Valley. No cull of the small mammals is planned here, but as Robin Gill explains, the cases are being closely watched.
There are about a dozen mink farms in British Columbia. At one location, there's been an outbreak involving 8 workers.
and there's a reason to worry.
Some mink will test positive but really show no symptoms at all and seem fine. Others will be sick and some will die. And so, of course, it's a concern to the farmers to try to protect their herds.
The mink live in confined spaces, densely packed together, and can pass the virus on to each other quickly. But when the disease goes beyond that, it's a bigger breeding ground.
Going forth and back between animals and humans is another opportunity for the virus to mutate at a higher rate than if it were to stay in one species only.
Take a look at what happened in Denmark, the largest exporter of mink. The industry was forced to cull all 17 million of its animals after 12 people were infected by a mutated strain of the virus. It had passed from humans to the mink and then back to people.
If there was a new strain that originated somewhere else, then the world would be, potentially exposed to a new virus.
In Canada, there are 60 mink farms stretching from Newfoundland and Labrador to British Columbia. The business, worth about $400 million annually, exports about 1 million mink, mostly to China and Russia, to be made into apparel. The industry doesn't believe a cull is necessary in Canada.
You don't have that concentration, and the risk of contagion and passing from one farm to another is much, much reduced.
The owner of the BC farm is in isolation, as are the workers. The health ministry is investigating to see what course of action needs to be taken next. Robin Gill, Global News, Vancouver.
Contagious bride ahead, the couple who defied a diagnosis and tied the knot. Nothing traditional about this wedding. A couple in India decided to go ahead with the ceremony after the bride tested positive for COVID-19. They dressed in full PPE, wearing face masks and hazmat suits, and it took place in a courtyard at a quarantine center. The only guests were the bride's parents and a priest. In southern India, a region already overwhelmed by COVID-19, a mystery illness has sparked another health crisis. At least one person has died and 200 others are in the hospital. The symptoms range from loss of consciousness to seizures, nausea, and anxiety. It was first detected on Saturday. A team of experts sent by the government is now investigating. Global News has obtained declassified intelligence documents that detail how neo-Nazis and other extremist groups have tried to take advantage of the COVID-19 pandemic by spreading false information and far-right propaganda. A secret national security brief prepared by CSIS outlined attempts to blame the pandemic on Jews, China, immigrants, the government, and societal elites. It also examined the spread of COVID conspiracy theories to attract new followers, raise money, and encourage violence. The report was prepared before the July 2nd incident in Ottawa when a heavily armed man breached the gates outside the Prime Minister's residence with his pickup truck. The suspect, a military reservist from Manitoba, allegedly shared conspiracy theories on social media. You can read more about the declassified report on our website, globalnews.ca/globalnational. Monolith mystery. Up next, the latest spike to appear, apparently, out of nowhere.
John is in the basement, mixing up the medicine. I'm on the pavement, thinking about the government.
Fans of Bob Dylan think his songs are priceless, but he's just sold the rights to all of them to Universal Music. All 600 songs dating back 60 years. The financial terms weren't disclosed, nor the reason Dylan did it. He has sold more than 125 million records throughout his career, though money never seemed to be his metric for success. He once said, "What's money? A man is a success if he gets up in the morning and gets to bed at night and in between does what he wants to do." Someone's been busy erecting mysterious metal spikes and provoking intrigue around the world. What started in Utah has now been repeated in multiple places, including England and the Netherlands. And there are some wild theories about who put them there and why. Redmond Shannon on the mystery of the monoliths.
Another day, another monolith, this time on the small Isle of Wight in England.
It was crazy. I was like, oh my God, we've got one here. Why here? It's so out of the way compared to like America.
Peter Hudd was one of the first to come see it early Sunday.
Even with my own eyes, it looked like it had been edited in. It was so like surreal looking. It was like a tear in fabric and time. It was just like this portal. Like I said, it's at the bottom of a very stiff cliff, like a very steep drop, and the only way up and down, without having to climb, is this wooden staircase, and it's steep as well. It's on a hell of an incline.
It was the same day a similar object appeared in the Netherlands. They're reminiscent of alien-installed monoliths from Arthur C. Clarke's Space Odyssey series, and come after 3 others were discovered in recent weeks.
So is it solid? Not solid.
The first had been sitting in a remote Utah desert for about 5 years.
The safe word is run.
Just over a week later, it was mysteriously removed on the same day that this one appeared in Romania, followed by another in California.
Christ is king! Christ is king!
That was also torn down, only to be quickly reinstalled. There are conflicting claims as to who's behind them and what they all mean. This amateurish version, a cheeky hoax from a candy store owner.
So how about this? I wake up Thursday morning and there's a monolith that appears right in front of my shop here in the Strip District.
Jumping on board what is most likely a copycat trend and a welcome distraction from all things 2020. Redmond Shannon, Global News, London.
We need distractions. That is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is this totem pole at Wascana Centre in Regina. BC gave the totem pole to Saskatchewan as a gift back in 1971 to mark BC's 100th anniversary of becoming a province. Please send us your Canada to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.